Now, let's move on to syphilis, my favorite. Why is it my favorite? It's because we're seeing a bit of an outbreak in Perth at the moment. Well, we're seeing it pretty much Australia-wide. We saw it initially in Queensland, and then sort of far north Queensland as well, Northern Territory, and we've also seen it recently in northern Western Australia, and now in the Perth metro area since mid-2020. So it's been announced an outbreak. We're seeing it in a number of different people. So we're seeing it in men who have sex with men, women of childbearing age. We're seeing it in Aboriginal people and homeless people. So Department of Health has funded specific projects in health promotion and public health, addressing those priority populations so that we can reduce this outbreak. And so it doesn't become an epidemic, basically, or it's like one down from a pandemic like we got with COVID. But nothing to worry about because syphilis is actually easily treated. So to begin with, syphilis has 4 stages of infection, so it's a little more complicated, and that's why I like it. And it's got your primary stage, which is where most people present with a symptom like a painless sore and ulcer, which is known as a chancre. You'll know it because it's sort of about maybe 10 or 20 millimeters in diameter, and it's flat. It doesn't look like a pimple, but it's sort of got a white filling in the middle. Now that white filling is full of that syphilis bacteria, and that means that if you have skin contact or any kind of sexual contact with that chancre, you're almost guaranteed syphilis infection because it's got a high bacterial load. So if someone presented with that on their genitals or within their mouth, then that's a cause for us to swab straight away because that might come up with positive syphilis bacteria, and that means that would warrant treatment. Secondary syphilis comes a few months down the line. People can present with symptoms like rashes. They can appear on the palms of your hand, the soles of your feet. You can also get what's called a dermatome rash, which is a rash, or like a band rash that goes along your torso. And that's because that bacteria has infected a specific section of your spinal cord, which is really fun. So you might get this kind of rash. Sorry?
I feel like you know a lot about syphilis.
Oh, you can tell. Like whenever I see a potential syphilis case, I get excited. I'm like, oh, I can get my detective hat on, and I can try to figure out their life story. And because it's also important to know about their past history as well to figure out what stage of syphilis it's in as well. Because you've got like early and late latent, which is where there's no symptoms, but if a person hasn't tested for 2 or more years, it means it's late latent. But if they've tested negative within the past 2 years, it's early latent. So that's the main difference between the 2 latent stages of syphilis. And then you've got tertiary syphilis, which is the one that we see we've seen with people in the 18th century, you know, when people have been locked up because they've had neurological conditions develop. You can have issues happen in your heart, your brain, your spinal cord. The most common things that I've seen with neurosyphilis, because I've had a few patients with neurosyphilis myself, they've been vision loss and hearing loss, and whether it's tinnitus or just like an aura. So they're seeing like a kind of an aura around certain items, and that can be permanent. So it's really important to note that I think with syphilis, good to do routine testing at any stage of your life because you might have had it 10, 20 years ago and not known about it. So it's really good to have a baseline syphilis test.
Yeah, and also because there's an outbreak, so like maybe now's the time to ask your doctor.
Absolutely. So and it's really important if your doctor says, oh, I don't think you need to get tested for syphilis, but you're sexually active, it's really good to go to a sexual health clinic because we will test for syphilis routinely just because we're seeing so much of it. Another good thing is we have the syphilis treatment, and also if you are a contact of syphilis, we will provide you that treatment preemptively, no questions asked, because we want to stop that transmission of syphilis early on. So yeah, that's syphilis for you. If you want to know more information, just go on the M-Clinic website. We've got a whole page on it.
Or call Joe specifically. No.
Or call me specifically, yeah. If I'm not busy, talk to me about it. I'll talk your ear off.